What's up, guys? This is Dr. Bailey from Dr. Bailey's Evolved Health and Wellness. Today's going to be a little bit of a different discussion. Um, the whole intent for me for these is to try to provide as much information and just general knowledge about whatever topics that patients are curious about. And we've had some good ones come up, some that I feel like I need to probably spend some time on. But I really want to make sure that when I do those, that I put them together as wholly as possible. So what I want to do today is honestly, I'm just going to leave the camera up and answer questions. I want to interact with you guys as much as possible. I do want to go over a terpene. Hey, Miss Matlock, how are you doing, ma'am? I'm going to start talking about one terpene in particular every Monday that we do one of these. Today's going to be Caryophyllene. It happens to be kind of my favorite just because it's kind of neat and how it works. Wanted to kind of go over a little bit about the program itself. Hey, Miss K, how are you? Any questions that you guys have, and whether it's the Arkansas program or the Oklahoma program, kind of what your thoughts on the programs are, what you'd like to see in the program. We've got some pretty cool things coming up from the Evolve side. We've been working on for a while an app, and in the app, my hope and goals with the app were to make it very much so like the Medical Mondays, where you have resources. You can kind of flip through some of the posts that we've made. Hey, Brian, how's it going, sir? Um, Also be able to find some dispensaries that are doing the right things as far as testing, knowledgeable staff, those kind of things. So from a dispensary side, we'll be reaching out to different folks in that regard as well. Um, a lot of times I talk about just general health, general wellness. I don't ever want to be the doctor that's the overweight doc that likes to tell a patient, hey, you need to lose weight, you need to eat right, and then not do those things myself. As a lot of people are aware, I'm getting over COVID right now. I'm about day 10-ish, I think, something along those lines. Right now, the only I've got a wicked cough that I just can't shake to save my life. And then actually last October 24th, I fought in Oklahoma City, and some people are aware, some people aren't. But I actually blew my knee up in that fight. I tore my ACL, strained my MCL, and tore a meniscus. So, and I say all that to kind of bring some light to the situation from the stance that life happens to everybody, myself included. And I'm probably going to chronic, funny enough, chronic my surgery, my recovery, everything that I do, because life happens and it sucks. From somebody who's very active and has always been somebody that kind of up and running and doing different things, and now I can't. Not only because I'm coughing my lungs up, but also because I blew my knee up. It's depressing and it's frustrating, and you got to figure out ways to kind of work through that process. So I'm gonna kind of chronic that with the Evolve page and my fighter page, Brandon Bailey as well. I don't know if I'm ever going to fight again. I might. We're going to see what the recovery is like. It's anywhere from 6 to 9 months is what I'm being told from now until I'd be able to fully go through contact again. I really like the idea of doing Ironmans or ultra marathons. If you haven't heard of any of those are the 50 and 100-mile races over 24 hours. I think that'd be kind of a neat thing to try and do. So just some different things. The reason I'm tying all that in with the Evolve things is because we're working with some processing companies in the background that we may have some really cool, exciting things coming up in the very near future. So just, kind of along with the app stuff there as well. Um, Again, if you guys have any questions about the program, if you guys have any questions about cannabis, about health, I'm leaving this open today just to kind of sit and talk with some folks. I'm always interested in what you guys are curious about, what you want to know about, whether it's your medications, whether it's interactions with cannabis, whether it's your doc. I actually had somebody I speak with kind of pretty frequently within the industry here in Oklahoma. They're going to have surgery here in the near future, and they said, "Well, what do I do with my anesthesiologist?" And even though I'm a doc and I'm a big believer in talking to your doctors, from what I've seen, most anesthesiologists don't understand how cannabis works. And Hey, Miss Alicia, how are you, ma'am? And they tend to tell patients, well, don't mess with cannabis, for several days leading up to your surgery. Well, I have a problem with that because we know looking at there's actually been several studies done within the VA system that show that cannabis actually helps induction into anesthetic easier. I probably wouldn't play with anything super high THC varieties of sativas or something right before surgery. I'd probably lean more towards an indica the day or day before, or something along those with a very similar terpene profile, something high in CBG, CBD. But it's one of those issues that a lot of you wouldn't want to stop all your medications before you undergo surgery. So why would you stop cannabis use? Um, if if I felt like anesthesiologists or anybody in the general medical community was taking the time to really look at how this stuff affects medications, it's going to prolong the effect of a lot of the anesthetic agents that we use. So it's actually going to make you slip off into adduction easier. Then I would say, hey, go ahead and tell them what you're using, strain specifics, all that stuff. But it's going to kind of go over their head, and out of fear, they're just going to tell you, hey, don't use it. Like I said, I'm not a big believer in that. I think that cannabis can actually help induction. We've seen it again in several VA studies. So that is just kind of something that got brought up there. Another thing, hey, Mr. Lane, appreciate that, brother. We're doing on cue. We're doing fairly well. This, like I said, this cough is no joke. Which reminds me, another big thing that we hear a lot with COVID and concerns in the cannabis populations. How can I use cannabis if with COVID, I'm concerned about my lungs. I mean, you've got a multitude of different use options, whether it's tinctures or whether it's edibles. Now, some folks don't metabolize edibles very well at all. Whether it's something to do with this, either the first or secondary bypass metabolism of the liver, whether you have liver disease or liver issues, or some people just don't metabolize it. We've come across those folks that they're kind of rare, but they just don't. They could have a 500 or 1,000 milligram brownie or cookie or whatever, and get zero effect from it. So that is probably when we lean more toward the tinctures. When it comes to anything inhaled, it's a lot of times it's going to depend on the temperature of what it is that's being inhaled. The higher the temperatures, whether excuse me, it's the coil in a vape or whatever it may be, it's going to be a little bit more caustic and irritating to the lung linings, which again is going to cause some possible bronchospasm or some issues there. I would probably, lean away from that if you're at risk for COVID or you're around someone that has COVID or you're recovering from COVID. Um, Again, the big issue with COVID that comes down to is the inflammation response. It's the amped up response of the immune system against your natural cells, because COVID is intracellular, it's an RNA virus. So what that means is it has to use the machinery of your cells to replicate or reproduce. It's like a lot of other viruses, honestly. I mean, the vast majority of them. You have DNA and RNA viruses, but RNA viruses, which again, that's what COVID is got to use your machinery. So by calming down that inflammatory response, again, that's going to help with your response and help you recover faster. It's really interesting to see how people respond to COVID. Everyone's responding a little bit different. Again, it hit me from the fatigue standpoint and cough. I slept for about a day and a half, and I had pretty solid headaches. I want to say I had body aches, but it was more, I just felt like I constantly needed to stretch. I mean, I don't know a better way to describe it, but that's kind of how it was for me. Where are we going to go? I wish I knew. Moderna's vaccine stuff came out today, and I know that there's going to be people on all sides of the fence when it comes to vaccines. And I've said this publicly that I'm not a big fan of a new rushed out vaccine. With that being said, will I be one of the first people to get it? Yeah, I'm active in the military. You better believe that they'll have us all lined up and we'll all be getting shots. And so I'm sure I'll be one of the first people to be able to tell you kind of what my experience was with the vaccine and how I felt and how many different shots and all that. Um, Miss Matlock asked, does elderberry really good for the immune system? We're actually seeing some really good responses with elderberry, not necessarily in COVID. There is some stuff that's going on with that, but in general, yeah, I like the idea of elderberry, or curcumin, turmeric. kind of leads into a little segue there with caryophyllene. Caryophyllene, as most people know, one of the major terpenes. And one of the reasons I really like it is the way that it helps with not just neuroprotection with Alzheimer's, with vascular dementia, and some of the other issues, but the way it helps keeping dopamine from breaking down. That's an awesome benefit that you have there. But also because of the way it affects CB2 receptors, and it can work in conjunction with CBD, CBG, CBN, and help profoundly decrease inflammation. And what we're really seeing in combination with CBN, that's when you're starting to see amyloid plaque breakdown. And for those that aren't aware, amyloid plaques are some of the proteins that help or not help, but that develop in Alzheimer's dementia. So yes, Miss Matt, like I'm a big believer in elderberry, big believer in um, giving the human body what it needs. A lot of times we don't get me wrong, guys. There's times we have to have medications, especially as hard as we are on our bodies. It is something that you know blood pressure, diabetes, cholesterol. Um, we 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 just need medications periodically. But if we do things the right way and we give our bodies the right things, then we can do some really cool stuff with it. Now, one thing that I've heard of or had a lot of people ask about is, hey, I'm new to cannabis, I'm new to the program, I'm new to everything. Where do I start? Um, when we look at cannabis in general, it's going to be a lot to what your comfort level is. When I say comfort level, are you okay with smoking? Or are you okay with vaping? Are you okay with edibles? You know, what is your comfort level when it comes to using cannabis? That's going to determine how you start. That's going to determine where your excuse me, where you go when it comes to cannabis. I typically tell people that cannabis naive or haven't messed with cannabis. Hey, let's start with a 5 milligram or less edible dose. Reevaluate 90 minutes, see how your response is. Start in the evenings when you don't have a lot of plans, nothing big going on. See if that, you know, that if you're calm and relaxed, if you're going to have a good anxiety response, if you're having restless leg syndrome, if it has the pain and the tingling in your legs calm down, you know, kind of where you're trying to treat and then what the expected outcome is going to be. You know, I put a lot of pressure on dispensaries, whether they realize it or not, because my goal is I want you guys as patients when you go to purchase something and you take it home and try it, be willing to go back to that dispensary the next day, the next week, the next month, and be like, listen, I tried this, and show them the product, show them the label, take a picture of the label, show them the percentages, let them know what it was that you tried, and say, listen, this is the response I got. What what do you recommend? You know, how do I get that response? Maybe it was too relaxing for daytime use, or not relaxing enough for nighttime use, or maybe you didn't get the pain response that you were hoping for. Those are all big things that we can use in the cannabis program to really not only just advance the your understanding of your response, but also being able to get the quality of life benefit that you're looking for. Because you know, 9 out of 10 times now, when I see patients right now, we have a lot of renewals coming through, but it's also a big picture of looking for how do we, excuse me, good Lord, how do we get these improvements without medications? That's what I hear about a lot of times. Let's see here. Brittany Vandola had asked, terpenes work well for migraines. Yeah, there's a bunch that will do very well in it, but what I've seen in migraines, so migraines actually, if I was to take my entire population, which right now in the Evolve Network is about 35,000 patients, and I was to take it and break it up, right now it's almost 60-40 women to men. My number one women specific diagnosis is migraines, and then followed in anxiety, depression, pain. And so with migraines, and on a little off topic, women are 40% more likely to develop migraines than men, and 40% more likely to have headaches in general than men. And they're more likely to have autoimmune disorders. And we think a lot of it has to do with possibly pregnancy and childbirth and those things, but there's a lot of research in that area. Now, what we're seeing typically when it comes to migraines, at least in the patients that we've discussed, seeing the follow-ups and the renewals, the sativa hybrids, interesting enough, are doing a really good job uh, of not only decreasing the number of migraines, but also the severity, which is a big deal. Terpenes, again, that's why I really, really like Caryophyllene. That's going to be a big, big plus because of the way it works within the providing as an antioxidant and inflammation relief, and it helps cross over the blood-brain barrier, so you get a good response to the nervous system, which doesn't happen with a lot of medications. That's why I really like Caryophyllene from a terpene standpoint. Now, White Widow, Critical Mass, Lemon Kush, those are all big strains that we've seen do a really good job when it comes to flower. Now, when you start looking at edibles, you start looking for tinctures, you're going to have some variability there when it comes to migraines. Let's see here. Edibles killed my restless leg syndrome. Standard doctors still don't believe I had this. And that's from Mr. Holt. I actually saw a bunch of people discussing wanting I don't want to say a recreational program, but an all access program, and where doctors can prescribe cannabis and make recommendations. And the problem with that is, and Mr. Holt just hit on it, so many doctors still don't understand cannabis and it's foreign to them. And they don't, because they haven't taken the time to really get involved with it, they don't understand how it works. A lot of them don't even believe that it works. And so there's so much headway to be made in that regard that you have to take that into consideration when you're asking, hey, let's open it up so the doctors can write for it. Yeah, they may write or they may not write for it. It's going to be a matter of what can we show, and as patients, unfortunately, it's going to fall on the patients a lot, because at the end of the day, pain, right? Pain is not going to be pain is not going to be something we can measure. I can't stick a thermometer on your forehead and measure your pain. I've said that 100 times, and I'll continue to say it. We have to rely on the patients and then as you guys to let us know, hey, my pain responded very well to this or did not respond to this at all. So as we progress with the cannabis program here in Oklahoma, I saw an interesting fact the other day. It's a little bit off topic. Apologize, my ADD is flaring today. But there's supposedly about 9,000 federally licensed cannabis growers in the United States, or state licensed, however you want to look at it. And supposedly in Oklahoma, we're approaching about 6,000. So that's an interesting little side fact there. But as the program grows and to that extent, I think we're going to see some really cool things come along with how physicians view this. Now, I've sat and talked with some really big medical providers as far as groups here in the like Tulsa Metro and the Oklahoma medical boards. Some are on board, some are not. And it's going to be something that a lot of people don't realize. They see all the social media posts and they follow along, and there's going to be some that are just against it no matter what we do and what the industry does, but there's some that are kind of on the fence about it, and I think we can really kind of sway them with the correct direction. um, Tincture used for fibro, that's going to be difficult. Miss Kimberly, she asked, in your opinion, what is the best tincture to use for fibro? So fibro is, again, I mean, you're gonna look for something with maybe a 1-to-1 ratio, from the stance that you're gonna want something with THC and CBD combination to it. And the reason being is THC is going to help calm down the firing of the nerves, because the CB1 receptor is going to follow along the nerves. Then you're going to get CB2 reduction with something, again, like Caryophyllene. I'm a big believer. I love Caryophyllene. The more I read about it, the more I learn about it, the more I like it. So you're going to have to find something that's got a good combination there. And it's going to depend on if they, when they produce it, if they have terpenes still in it or not. Sometimes they strip the terps out. Specific for nausea and vomiting, that's going to be tough. Um, Miss Gallagher asked, anything specific for nausea and vomiting in her first trimester of pregnancy? That's going to be tough. You're going to be, it depends on if you're looking at flower, you're looking at edibles, you're looking at tinctures. Again, You're typically going to see several of the indica dominant hybrids are going to do better for nausea because of the way they help decrease inflammation around the stomach lining and where several of the CB2 receptors are located in the GI system, and it helps with the smooth muscle relaxation in some of the GI tract as well. That's probably where I would lean to, but again, it's going to also depend on where you're at and the availability in your area. Oh, let's see here. Those are good, guys. I like those questions. Keep them coming. I'm more than happy to try to answer any questions that you guys have. You know, it's again, my goal with this is to provide as much information as I possibly can. So if you come across something you want to know about, shoot me a message, put a comment. I'll be glad to get you taken care of. Let's see here. I think I got most of you guys caught up here. We are going to try and do some more topics coming up. So Ms. Clements asks, my inflammation is making my white blood cell count high. Is there anything I can do? So it depends on how high your white blood cell count's getting. White blood cells typically will have some variation there, but inflammation itself isn't just going to um, make your white blood cell count go up. Counts ferritin is a acute phase reactant, platelet counts. There's a lot of different things that will go up with inflammation. White blood cell count, not typically, at least not enough to really be concerned about. Inflammation can be triggered from a whole bunch of stuff. Either dietary inflammation, general aches and pains, wears and tears, poor sleep, poor hydration. I mean, there's a lot of things that can truly cause inflammation. I think some things kind of get a bad rap for it, but in general, you have to look at what all are you doing? Are you smoking cigarettes? That's the biggest inflammatory thing in the state of Oklahoma, Arkansas, Missouri, Kansas, Midwest United States that we do on a constant basis. That is some of the most, I mean, pure poison that we can do. There's a lot of studies that have come out that show that the air that comes out of a cigarette filter is actually dirtier than the air out of your exhaust pipe of your vehicle. So if you have to look at all the different things that you have going on. Um, let's see here. Patients to get off meds. Geneva Roberts Matlock asks, do I ever have any patients get off meds and use medical cannabis only? I would say at this point, it's about 60% of all my patients have been able to do that. It's pretty profound. Do I have a lot that stay on meds? Yes, but I have a profound number that are able to come off of meds. Now, when I say come off of meds, it also is going to depend on the program and the state that you're in. We're blessed in Oklahoma, you know, by being able to grow, having the huge number of dispensaries and processors that we're due. So you have a huge number of product selection. So, you know, you get over in Arkansas where they can't grow, there's a constant shortage. It's much more difficult for patients in that area to come off of the meds than it is to say in Oklahoma. So definitely something that's going to depend on where you're at. That is also the beauty of cannabis. If you think about it, and I say this a lot, I don't think I have it in here. I usually keep a bottle of Tylenol in here for when I'm talking to patients. And the reason, and I've said it in these Medical Mondays before, if you look at Tylenol, it's got one bioactive compound in the whole bottle, acetaminophen, right? Cannabis has, at this point that we know of, 62 different bioactive compounds per plant. And so it's the distribution of those compounds that varies from plant to plant. And it's the distribution of those compounds that gives us these variety of effects. When you hear about the entourage effect, you hear about all the different things that can happen with cannabis. So that's why you have immense power in your hands to treat a variety of different things depending on how you respond to them. That's also why I highly, highly encourage folks to look at, hey, when you go to a dispensary, tell them how you responded to this product or that product, or how you responded to this strain or that strain, because it's your response that gives you the benefits. Now, Miss Nicole, how are we doing? Correlation with AFib, high blood pressure, and cannabis. So the big issue that we see right now, I don't even want to say with AFib, but what that we can see is that the high THC strains and varieties, the fire flower that we hear about at so many dispensaries, that a lot of dispensaries are worried about trying to get. Um, Problem with that is it can cause a spike in your heart rate. If you have underlying medical conditions and heart issues, could it trigger a fib? I don't know about all that. I think I would have to see some research into it, but I could see if you have the underlying risk factors there that you could, get a spike in heart rate. Now, if you're sitting there going through dabs or something that's super concentrated, you're going to have much more of a likelihood of increasing your heart rate. That's also why I typically try to encourage, especially cannabis naive folks, to kind of lean away from a sativa dominant varieties or concentrate because of that reason. Let's see here. Blew a disc in my neck, getting surgery on 25th. Boom, 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 boom. Yes, Ms. Nicole asked a question about the anesthesiology that I kind of referred to earlier. Um, Another thing that she asked about is cannabis-induced hyperemesis syndrome. That's another big thing that comes up a lot, whenever we discuss cannabis. And from what we've seen, strong correlation with poorly produced, I guess is probably the best way to say this, cannabis, neem toxicity, some of the other things that can be added to cannabis, trying to increase growth and loadout. Also, different insecticides and herbicides, which is the importance of testing. My big frustration right now in Oklahoma is our testing sucks. Our labs, not all, not universally, but in general, they suck. There's no reproducibility. If I was to take a group of a product to three different labs from the exact same batch, I'm going to get three different, vastly different results, and I'm a huge. I hate that because as a physician, it's hard to recommend standardization or how you should go about things when we don't get similarities from strain to strain or from dispensary to dispensary. Let's see here. This should go. I used to treat my PTSD. Discuss when the doctor about possibly having to start back on my meds. Do you think the prescribed meds or marijuana is better during pregnancy? So, pregnancy, we actually had a long talk about. I did a video on Alicia a couple weeks back. I would go back and kind of refer to that video and because I went over in depth about pregnancy. The big thing to remember with pregnancy is that 70% of THC of all THC products is past the fetus. So we really want to avoid sativa dominance and even one-to-ones in pregnancy. And the only reason I say that is because for right now, we just don't know enough. We know that the CB2 receptors, we actually get some neuroprotection. Again, like we discussed with Caryophyllene earlier, that's a big thing. And when we see that babies have no deficit from it, no long-term issues, but until we know more about from the cannabis perspective and the THC, and especially Delta 9 and some of the others, I would avoid anything with higher THC percentages. Now, when it comes to medications and trying to treat PTSD, it's another video I went over in depth, and I'm going to start probably revisiting some of these because PTSD in itself is it's a big ball. When you look at PTSD, what you have to realize is it's anxiety, depression, night terrors or troubles with sleep, large crowds, loud noises, anger outbursts, all these big variety of things coming together to make one diagnosis. So you got to really look at it from the PTSD perspective of what are you trying to treat? So if you're trying to treat these other varieties of issues, anxiety is your primary issue, or maybe it's the sleep issue, that's going to determine what it is you're trying to use, if that makes sense. And then you can kind of add the other filter for the pregnancy and the low THC varieties and then address it from there. Let's see here. So, let's see here. Geneva Roberts, boom, boom, boom. I refuse to use narcotics, but everything that's been tried for my arthritis inflammation hasn't worked. I had an epidural injection several weeks ago and still no relief. Doesn't really surprise me. Epidural injections aren't going to do a whole lot for arthritis and inflammation. If you have nerve impingement, I guess if you have degenerative disc disease and you have some real bad inflammation at the disc root themselves, they do an epidural in that area, and especially if there's a corticosteroid involved, yeah, you can probably get some short-term pain relief. I've had that in my back after my wreck. I had a really bad wreck in 2017. Rolled my truck like 200 yards on the highway because it was a wreck right in front of me. Did the injections, did the physical therapy, but inflammation relief, again, you're really going to have to find something that's high in CBD, CBG. Not so much CBN. CBN is going to make you tired, but something that's going to help decrease the nerve, or not nerve, decrease the inflammatory response of your immune system. That's all inflammation is, especially in the joints. You know, you get that constant wear and tear, you get leukotriene production. For those unaware, leukotrienes are just a compound that your body makes that's inflammatory based, or it can be inflammatory based. Allergies are also very similarly produced. Leukotriene inhibitors, a lot of medications along those lines as well. But what I would strongly recommend, and something to actually hopefully we'll have something out and more information on soon, are the topicals, especially when it comes to the joints and you're talking about inflammation and arthritis in those areas. All right, y'all. Let's see here. Any other big questions? Those are good. I really appreciate everybody taking the time to comment. The only thing I don't like about these videos is for reference. If people want to try to find certain topics, it sometimes is hard. But on the flip side of it, I think that we've been able to really cover some really cool topics here today. I'm going to continue to add to these. Again, we're putting some posts out. The Hinton Height ladies, there's several of the other, like Miss Nicole and some of the other ladies putting out posts. If there's a topic that you're curious about, or a group of topics, let me know. Again, the other thing I really want to try to do is cover a different terpene. And so today's big one was caryophyllene. And so caryophyllene, it helps inhibit the breakdown of dopamine, so it kind of helps dopamine float around a little bit longer, helps protect inflammation on the nerve roots, because as well as with the vascular system for vascular dementia, helps break down amyloid plaques and Alzheimer's dementia. Um, it also has some antibacterial benefits, antifungal benefits. There's been some really cool things, again, that I've really started to look into when it comes to um, um, caryophyllene itself. Can help with sleep in combination with CBN. There's some research going on in that area as well right now. Boom, 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 boom. It also helps increase your natural endorphin production, so it helps decrease inflammation for pain relief. There's all kinds of discussions about some of the receptors and possibly inducing apoptosis, which is cell death in various types of cancers. I'm always real cautious with cannabis and cancer, but on the flip side of it, there's no harm to it, so always a positive benefit there. There's some topics and discussions about increasing bone density as well as helping with weight loss. So caryophyllene kind of has some really neat possibilities to it going on the road. So I'm all sorts of eyes and ears when it comes to that. All right, guys, I've talked everybody's leg off. I think today it's one of our longest videos. If there's anything that I can personally help with, shoot us a message, let us know. Evolved is up and running. We're booking out into mid-December. We will be closed right around Christmas. I'll be open for a little bit on Black Friday, be open for a little bit between Christmas and New Year's. So if there's anything I can do to help, shoot us a message over to the Evolve page, or be glad, message me personally. I'll be glad to help in any way I can. I hope you guys have a great rest of your week. We'll talk to you later.